Hello, everyone. My name is Claude Bercius. I'm going to be presenting Module 8, 9, and 10 theory presentation. And my theory that I'm going to be talking about today is Lazarus's stress coping adaptation theory. So I'd like for us to start with what is stress, coping, and adaptation. So stress for me, the way I've kind of defined it, is an automatic physical response to stimulus that requires a person to adjust or make some changes. The other way I turn to look at this is a feeling or condition experienced by a person when one perceives that the demands exceeds personal and social resources that individual has or is capable of mobilizing. So once you have a situation on hand or condition on hand and you don't have the resources to address those, um, people tend to be stressed by such. So as a result, is that automatic physical response tends to kick into those stimuli that we've talked about. So let's look at some common stressors. I thought we should put that into perspective. So if you look at this list, it talks about money, work, the economy, family, relationships, job stability, family health, personal safety. But I also want to draw your attention to the World Health Organization has stressed that health is an epidemic of the 21st century. Now, within the healthcare arena itself, the causes, stress have caused of higher level of expenses for health related issues relating to stress. It has increased the expense of replacing staff. It has high costs for medical errors, prolonged hospital stay for patients, complications with chronic medical conditions. It is estimated that American businesses have spent approximately $300 billion, or it's cost American businesses $300 billion per year. The Wall Street Journal also identified that stress is the #1 workforce risk issue. And it leads to poor decision making, decreased productivity, decreased effectiveness, medical expenses, and attrition. So we all see how much stress has an impact on not just people in healthcare or people with medical issues, but in the population in general, our economies, and so forth. So let's look at what stress does to the body. So we look at short term. When you are stressed, you get feeling of worry, nervousness, unable to switch off. You have palpitations. You start to breathe, faster, rapid respiratory rate. GI issues, which is your tummy upset. Your skin sometimes become more sensitive. People with anxiety that have serious anxiety issues sometimes tend to break out. Muscles become very tense. But long-term wise, these things lead to tension, headaches, and migraines, mental health issues like anxiety, depression, and worsening of other chronic mental health illnesses like bipolar, schizophrenia, and so forth. People start to have panic attacks. Skin and hair conditions starts to become a problem. Increased diabetes risks because once you're very stressed, your mineral cortical hormones releases a lot of glucose into the bloodstream. So your risk for diabetes also increase. It also has fertility problems with men and women. So what is stress, coping, and adaptation? So coping, if you look at it, is our ability to, the efforts we put into control, reduce, or learn how to tolerate threats that leads to stress. They are characterized by the attempts we made to manage our stressful stimuli. Adaptation in itself is when the individual, try to make the necessary desired cognitive, behavioral, and affective changes in response to the environmental conditions or demands. So successful coping tends to result in adaptation. So adaptation in itself tends to enhance the ability for us to meet our basic needs, improve social functioning, and optimal mental and physical well-being. Now, so if we have good adaptation, we find that there are so many resources behind how one can adapt. So some of the resources that you can take into consideration is good health, energy, positive beliefs, social skills, material resources, personal control, and at the same time, social support. It enhances our capacity to survive and flourish, which is basically what adaptation is all about. So if you put all these resources into place that are coping skills, it enhances your ability to be successful and adapt to a stressor or a situation that may increase your stress. So what is the purpose of this theory, the adaptation, stress coping adaptation theory? And the primary focus is to understand how a person cope or deal with stressors. It is also a process-oriented approach. It looks at how a patient responds psychologically to stress. It discusses the interrelationship between stress and coping. So if you look at what it's talking about, you see when someone gets stressed, it looks at our primary appraiser. How does this person as an individual can look at it and evaluate how this stress is impacting them? It also has a secondary appraiser, and it looks at how we cope or our coping response. Now, if you also look at what it means to have a process-oriented approach, this has to do with how a person thinks or does within a context of a stressful encounter. So process oriented is how can I get through this process? What is it causing me these pain or suffering, all these emotions I'm having, all these difficult situations I'm dealing with? How am I going to think about it? What am I going to do about it? So it also looks at our thoughts and actions as they unfold with regards to stress. It looks at what he or she thinks about stimuli. And it states that coping is very dynamic in nature due to stress and situational changes. So it talks about how a person appraises and reappraises stressor in relationship to his or her environment. So basically, what I'm talking about is just trying to expand on what I have in the slide. So it's how this theory just helps us with appraisal of how we look at our stress, how we evaluate our stress, how does our stress impact our health and well-being. So what is the scope and level of this theory? What is its origin? So basically, there's a behavioral sciences origin, and it's been utilized in nursing. It's been borrowed from behavioral health, and it's being utilized in nursing. It was developed by Lazaro as a part of transactional theory of stress coping in 1966. This presents stress as a product of transaction between a person, including multiple systems, which is cognitive, physiological, affective, psychological, and neurological, and his or her complex environment. So it was also based on a general adaptation syndrome, which this syndrome mostly focuses on our physiological response to stress, whereas stress coping and adaptation looks at how we think and deal with stress in a psychological manner. So some major concepts of this theory, some of the major concepts that you have is the person and the environment relationship, which looks at how factors that impact our personalities, which are valued beliefs, commitments, social network, social support, demand, constraints. How are these things they are influencing our stressor, or how is it that what is our influence as well on the environment? So people we interact with. So it's kind of vice versa kind of situation. Now, these factors can be precursor to stress, like I talked about. It also can be interpreted as a stressful stimuli. If you go back to what I talked about initially about what stress is all about, say when a person has a condition where he or she does not have the resources to cope with those stressors, it leads to a stressful event, and the patient or the person struggle to cope and also impact physical and mental health and leads to other things that we've talked about. So it's the same thing. If you don't have a good value-based system or belief or commitment or social network, social support, social cultural factors that will influence you to cope better, things tend to be much more difficult when it comes to stress for you. So the other thing I want to look at is cognitive appraisals. So the first thing is primary appraisal, which I talked about briefly. It includes the patient, the individual's ability to evaluate and the significance of a stress. Now, let's take, for example, there was a study that I looked at, talk about someone with left ventricular assist device. It says the primary appraisal for this person occurred during the initial implant of this device. and the transition to whom, in which they will be responsible for maintaining these devices. So you have the patient has a heart failure situation where they're not responding to medical therapy, and they decide that we have to put in an implant, which is this left ventricular assist device to help with the heart contractions so that blood can be pumped to the rest of the body. And the first thing that you have to appraise is, how am I going to deal with this? How is it going to impact my life? What am I going to do? It's almost like if you look at someone who has end-stage renal disease that is about to start hemodialysis, you start to think about, how is it going to impact my life? How am I going to be able to continue to survive? How am I going to be able to go on vacation? What is that am I going to do? How is it going to make me feel? What is it? So you start to ask yourself questions and you're thinking about things that is impacting you. That's basically what a primary appraisal is all about. So secondary appraisal studies how we respond or cope to the stressful stimuli. So after we have appraised it, now we have to act. This basically looks at our behavioral or our affective response. So behaviorally, what am I going to do? Am I going to learn how to use this machine properly so that I can live the best possible life and have an optimal quality of life? Am I going to follow through with treatment protocols for my end-stage renal disease? Am I going to go to dialysis as I should be going to? Am I going to do all the things that I need to do? Am I eating right? Am I sleeping right? Am I taking my medications as I should? So that's the goal of this. It also takes into consideration how it's more of a problem focus and emotional focus coping. What are things we can do to help our situation becomes better? So if you look at problem focus coping, it is improving your stressful situation and you have a problem, right? So this is your problem. My problem is my supervisor at work is giving me a lot of hard time, is pressuring me to do things. So what is it I can do so I can minimize any problems with this? So you start to formulate your own problem, your own solutions in your head, coming down with strategies to deal with this problem. That's a problem focused approach in terms of stress coping and adaptation. Emotional focus tends to look at what kind of things we can do to relieve the stress. Our deep breathing exercises, meditation, yoga, exercises, walking, talking to people about your problems. These are things you do that will help you minimize the impact of stress on your physical or mental health well-being. So a problem focus, if you look at another one with the patient with left ventricular assist device, loss of independence or stressor. So now you start focusing on how I can do things to become more independent, improve my activities of daily living, help to establish a sense of control. So you can see that from that perspective, why the emotional focus for that LHVH patient would be having a positive attitude, sense of humor, prayers, and some of the other things we talked about. Spending your lunch break, reading a book to distract you. These are all healthy activities that improve your outcome. So what is the nursing implication for this theory? How can it apply to our nursing process and all the different things we do? So basically this theory provides a framework that we can use to assess the effect of stress on physical and psychological well-being of a patient and healthcare professionals. So we can use it to assess coping processes in a person. It plays an important role in problem solving and cognitive restructuring. It can be used as a research framework for addressing stressors in healthcare environment for nurses. This is essential in improving self-care, coping, and health and well-being. So I like to take a little spin on this whole theory and try to see how best. I know a lot of people are going to be doing similar thing and talking about patients, but I like to focus this part a little bit on nurses. So nurses' stress and lack of self-care. What are some of our stressors that we find as nurses? You have many factors contributing to these things. Job security, pressure to accomplish the same work, but with fewer people in a tight economy. When you have difficult economy, people tend to lay off people, and the same job has to be done with limited resources and limited personnel. Possibility of a 24/7 work-related communication adds to stress. Constant threat of a crisis situation. Considerable physical demands. Patients and their families who become demanding in response to their own stressful situations. Dying patients. Conflict between co-workers as well and others. So these are different things that impact stress so much. So the practice environment, continuous changes in equipment and procedures. We talk about evidence-based study, but those are things that are all necessary, but also increase the stress level because you feel like you have to be on top of the latest evidence to provide the best quality of care. And all these different things, new equipments and all the kind of stuff, attribute to most stress. Staffing, long hours, interruption in patient care, concern for patient safety and potential litigation, interpersonal relationship, role ambiguity, patient-related stressors, including high acuity. We talked about the deaf and dying, diverse populations that you have to deal with. Some people have never interacted with a lot of other people from different backgrounds. So the fact that you have to learn something new about somebody to provide the best possible care and be more culturally sensitive is also stressful. Limited resources and feelings of lack of control. These are all things that nurses experience and lead to stress for us. So let's look at some ways. If you look at how we talked about primary appraisal and emotional, primary focus, problem focus, and emotional focus. So if you look at it, there is a diagram I have on the left that talks about the cognitive things that you can do to address those things, which are all linked to somehow problem focus and emotional focus. You have therapy, hobbies, meditation, mindfulness, planning, reading, time management. Physical would be artistic expression, deep breathing exercises, natural medicine, physical exercise, realization, yoga, music, nature, pets, spa visit, conflict resolution, prayer. These are all things that you do that are very essential to your overall health and well-being. That I think nurses as well should incorporate these things into self-care, which will lead to coping and will lead to health and well-being. If you look at emotional focus, which you talked about, emotional focus looks at exercise, taking a bath, giving yourself a pep talk, meditating. Problem focus look at working on time management, ask for support, establishing healthy boundaries, creating a to-do list, which is planning, priority, organizing, and establishing some routine for yourself. These are all combination of things that can enhance our self-care and is a part of stress coping and adaptation theory. So some of the general things that I just wanted to that nurses can utilize for self-care is communicating with your patients, but not to tell your patients that you're overwhelmed or what you can do. Debrief with your colleagues at the end of your shift. Share successes and share your frustration. Start a low journal. Focus on what went well, what could be improved. Don't just dwell on the negative, because when you dwell or ruminate, it makes your anxiety, depression, all the different things persist. Plan what needs to be done. Write it down in the journal. Remind yourself that you're capable. One thing when you start to have self-doubt, it limits your ability to take care of yourself. It limits your ability to be efficient. It limits your ability to be successful. And stress can do these different things to you. So every now and then you have to remind yourself that you are capable, you've been able to accomplish most important things in life. Skip your thoughts about work with entertainment and socialization. Find good friends. Find people you can hang out with that will also give you positive vibes that you can have fun with. But these are good and healthy things that we can do to take care of ourselves. So some of the things I already have talked about, these yoga, meditation, protect some me time. I love me time. Me time is creating a routine and engaging in some daily activities that is relaxing, developing good social support amongst nurses, which is ourselves, and avoid unnecessary competition. Think positive. Always view setback as temporary. View change in healthcare as a normal process, constant. It is not a challenge. It is a challenge, but it's not a threat to you. Changes is constant and it will always happen, but they are not a threat to you. Exercise to release your frustration. So these are all the things we talked about: avoiding caffeine, nicotine, alcohol. Complete something tangible at home to give yourself a sense of achievement. You got to have something outside something else outside of work. So if it's cooking, baking, cleaning, may all offer a sense of achievement. Talk about your problems to your family members and peers, but focus on activities that help you relieve stress. Now, other thing I wanted people to just be aware of: alcohol and drugs are it does not do anything to make your stress better. After you've come through your high or whatever um, depression with the alcohol because it worsened things. After these things have passed, your problems are still there. So using these things are only short term. It gives you very minimum relief, but your problems even worse after after you've recovered from using these different things. So what can a healthcare organization do to empower us? They can encourage sponsorship, provide resources, and give by organizational management to staff. Relationship wise, we can deal with, they can help with dealing with conflict and unacceptable behavior in a constructive manner. Role, they can give us, they can help with making sure that every individual understand their role and responsibility. The other thing is change. Yes, change is going to be constant, whether it's large or small, but it should be managed and communicated in a very proper manner. Optimally, organizations should make stress assessment and management an ongoing priority. They have to always look at it. Is there anything we can do to minimize the stress of our employees? Is there anything we can do to make sure their work is easier? To make sure that they don't leave from here with being burned out. They don't leave from here having compassionate fatigue. Different things that it can do to just make sure your life is much more easier and that you can function at the highest level. So using self-care coping strategies successfully will allow nurses who are graduate students like myself to adapt and manage to find a balance. It will improve our daily social functioning, health, and well-being overall. So how is this theory very helpful to nurses in the future? This concept of coping stress and adaptation is going to continue to play a very important role to the field of nursing. It's going to support future nursing related theories and evidence-based practice through research. So it has a tremendous it will continue to have a tremendous impact on the field of nursing. So this is the references, and it was a pleasure presenting this topic, this theory to my fellow students. I hope that you've learned from it, and I hope that this can in some way at least help you better cope as nurses, learn how to deal with stress, cope, and adapt.